This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're in the Women's Health Department of the Aurora Medical Center in Oshkosh. And it's not unusual to see people with babies up here. But you know, for some women, they have trouble conceiving. The good news is, here at Aurora, they have a specialist that can help you. Dr. Frank Wittmaack is our guest today, and he's going to be talking about what he does as a reproductive endocrinologist. Well, Dr. Wittmaack, thanks for joining us today. Let's start by talking a little bit about your background and maybe the difference between an OBGYN and what a reproductive endocrinologist does.
Yeah, sure. People hear the word reproductive endocrinologist and don't always know what it is. It's basically an infertility specialist. All the infertility specialists start out as OBGYN. So that means I did my OBGYN residency, my 4 years of training, and then afterwards I went on to do what we call a fellowship. That's a special training in reproductive endocrinology and infertility.
Yep, and there are many people that have trouble when they're trying to conceive, and you know, how long should a couple try to become pregnant before they should start seeking medical help?
That's a very good question. We get that question a lot. Some people have this unrealistic expectation that they just try for a month or two and they should really be pregnant, and then we'll just have to take a little step back and say, hey, you know, typically it takes about up to a year to achieve a pregnancy. And after a year of trying without success, then that's when we would recommend a workup. Now, there are some exceptions. Some people, obviously, who have problems, like, for example, periods are not regular, those people might want to be seen sooner. Or also people who are over 35, because of that biological clock ticking, we like to see them after about 6 months. But the normal, regular person would be allowed to try for about a year before, you know, seeking our help.
Yeah, you just mentioned an infertility workup. What's involved in a workup?
Yeah, the workup is actually fairly straightforward. What we like to stress is that we would like to see both partners, which is the male and the female partner, for workup, because we don't always know where the problem lies. And the workup consists for the woman typically of making sure that her menstrual cycles are regular, that she releases eggs. The tubes will be checked to make sure that they're open, and we'll check the uterus to make sure there are no irregularities such as fibroids or polyps. For the male partner, it's just typically a semen analysis, a sperm count, just to make sure that there are no problems. And this can all be done typically within a month. This is a fairly compact, straightforward workup.
Yeah. I would imagine you work pretty closely then with some OBGYNs then as well.
Yes, the OBGYNs are very, very valuable in this relationship. And most people typically start out seeing the OBGYN with questions of getting pregnant. And the OBGYNs are usually very much in tune with doing the basic workup and also some of the less invasive testing and treatment. And when they feel they have done what they can for the patients, they usually then let us know. And then at this point, I would take over and see what we can do to help the couple achieve the dream of having a baby.
Right. And I would imagine cost is always on people's minds. Can insurance play a role in this?
Yes, and I'm glad you brought it up, because a lot of patients are worried about the insurance costs. They think it's going to be an astronomical amount of money that they have to pay, and then they oftentimes are very pleasantly surprised when they find out that the insurance oftentimes pays a large amount of the workup to find out why somebody is infertile, why there is a problem with getting pregnant. And we actually have a specialist, a billing specialist in our department who can do all the legwork for the patient. So in other words, if there's an uncertainty as far as how much the insurance covers, we can do this free of charge for the patient, and most of the patients will be very pleasantly surprised to see that the insurance covers a very large portion of the workup.
Yeah. What are some of the treatment options when you identify what some of the issues may be with not being able to get pregnant? What are some of the options that people have?
We have a wide variety of treatment options, and people sometimes just associate in vitro fertilization as our most aggressive option with something that they have to do, and then they also get scared because they think it's going to be too expensive. And the majority of patients actually can do something less invasive, something that is easier and less expensive than, for example, IVF. It comes down to sometimes simple things like going on fertility pills to regulate menstrual cycles. It can be sometimes minor surgery to correct any problems with, let's say, the uterus, some polyps, fibroids, those kind of things can be removed. It can also involve, for example, inseminations where we put the sperm directly into the uterus, which oftentimes can treat mild factors of male infertility. So we have a variety of options to help patients. And obviously, if nothing else works, we can also resort to IVF. Our center offers the wide range of fertility options.
Right, and some of those things that you just mentioned, they can be pretty pricey. And we talked about the insurance. Are there things that we can do to help save some money in this situation?
Yes, we're very fortunate to have programs in place that will help patients save money. Patients who have no insurance coverage, they would automatically get a discount because they're self-pay. We also have, for the higher end options for, let's say, in vitro fertilization, programs that are very popular. They are called, we call them shared success programs, where we basically guarantee them a baby, and if we're not successful, they get 70% of the money back that they initially put out. So, telling them that we are in this with them, and we're willing to put, our name and money on the line just as much as they do. And I hope that'll relieve some of the financial anxiety that patients might have going into those programs.
Yeah, it sounds like a terrific program, and the main thing is the couple ends up with a baby.
That's our goal. Their success is our success.
Yeah. Dr. Wittmaack, we appreciate you taking some time with us today.
Thank you so much for having me.
If you have any questions about infertility, you can contact your primary care or women's health care provider, or you can give us a call here at Aurora at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.